our video off, right?
Great to see so many people joining us for this webinar. We'll just wait maybe another few moments before getting started. So it looks like we're getting some stable numbers there. So we might begin. And it's my pleasure to welcome everyone to this introductory webinar on the 1,000 Cities Challenge. I'm Melanie Lowe, based at RMIT University in Melbourne, Australia, and co-director of the Global Observatory of Healthy and Sustainable Cities, which hosts the 1,000 Cities Challenge that we'll be discussing today. So a big thanks to the other co-director, Deborah Salvo, and to the whole Global Observatory team for their efforts in setting up this project and also to helping organise this webinar today. So in this session, you'll learn about the Global Observatory of Healthy and Sustainable Cities, and importantly, our 1,000 Cities Challenge, including how you can participate in assessing the health and sustainability of your city. So as a bit of an overview, first we'll hear from Jim Salas and Billy Giles Courteye, who'll provide an introduction and background. And then Deborah Salvo will take us through an overview of the 1,000 Cities Challenge, including the benefits of participation. I'll then briefly discuss what's involved in generating the policy indicators, and then I'll pass over to Carl Higgs, who will cover the spatial indicators. You'll also learn from Eugene Resendez about how you can sign up and become a member of the challenge and receive updates from us. And hopefully we'll have about 15 or 20 minutes for questions at the end. So just letting everyone know that we are recording the session, and the recording will be made available if you happen to miss something or you have to leave early. Please keep yourself muted during the presentations and feel free to post your questions as they arise at any time in the question and answer box. We'll address those questions at the end, and you can also raise your hand during the Q&A and we'll invite you to unmute and you can ask your question verbally. So I'm going to now pass over to Professor Jim Salas, who is a professorial research fellow at the Australian Catholic University in Australia and also based at the University of California, San Diego.
Thank you, Melanie, and hello, everybody, and thanks for joining us and thanks for your interest. So I just want to give a brief rationale about why we need indicators for healthy and sustainable cities. I'm going to start with the 2016 Lancet series that Billy Giles Courteye organized that included a set of literature reviews linking the design of cities, urban design, with all of these health outcomes that are listed here. And many of them are related to motorized transportation, but not all of them. And I'm thinking of two things. One is that all of these health problems that are listed are pandemics that are happening at the same time and that interact with each other. That makes them syndemics. And so we have a lot of syndemics going on right now. And the other thing that I think is helpful to think about is that urban design and also transportation policies are solutions that can help solve multiple problems. And many of us think of those are the best kind of solutions. But all of these health problems are not the end of the story. We need to add at least two more pandemics, which are climate change and infectious disease. And I just want to give a brief look at that. So you probably know that a couple of weeks ago, the International Intergovernmental Panel on Climate Change came out with a new report that focused on solutions. And here are a list of solutions from the Medical Society Consortium for Climate and Health that I think is mainly in the US. But I've starred two of these solutions that are directly relevant to our urban planning and transportation. And you can see clean and active transportation and climate smart community environments. So that's the link to climate change. For COVID-19, I'm just going to refer briefly to this commentary that Deepti Adlaka and I published early in the pandemic, where we identified a list of environmental attributes that we know by research are related to non-communicable diseases, including obesity and heart disease. And we predicted, based on the link with these environmental attributes and physical activity, that there would be similarly beneficial effects of most of these environmental attributes for infectious diseases. And in fact, since this was published, there have been, I would say, a handful of studies that generally show support for our hypothesis that these environmental attributes have favorable effects on infectious disease, on COVID-19 specifically. So that's an emerging bit of evidence. And I'd also like to make the point that the indicators that we are going to be talking about are very consistent with the United Nations Sustainable Development Goals. They relate to 6 goals and 14 targets. So again, solving multiple problems. And just to make it clear what we're talking about, is that all over the world, cities are pursuing policies that generate what we see in these stamps. And that is, on the left, separate use zoning, puts destinations out of walking and biking distance for many people, distance from their residences. And on the right, we see this is a symbol for an overemphasis on road travel and vehicular travel, and while ignoring active transportation, walking, biking, and transit. So in fact, these urban design and transportation policies and resulting built environments make active transportation difficult or impossible and enforce fossil fuel dependency. So this is what we are, those are the climate and the health goals that we're trying to change. So now I am going to turn it over to Dr. Billy Giles Corti, who's going to give a little bit of background on how we developed indicators, how we developed measures of those indicators, and then tested their feasibility. So Billy, over to you.
Thank you, Jim. And I'd like to also echo and give a very warm welcome to this event, and thank you for joining us. I'm going to be talking to you about our Lancet series on our second Lancet series on urban design, transport and health that was published last year in the Lancet Global Health. You can see the cover of the Lancet Global Health on the right. And it built on the it was launched actually, this Lancet series, or the work that was going to go into the Lancet series, when we were at the same conference where the global action plan, the WHO global action plan was launched, the More Active People for a Healthier World, which outlined the strategy about what needed to happen. First of all, that there needed to be active people and active societies, and the way to achieve that was through active environments and to look at active systems. Active systems was about the governance of our, well, in this case, our cities. How do we create governance that was designed to be active, that would encourage people to be more physically active? And so it was interesting that we were launching our idea for a Lancet series at the very same meeting, and we aligned very nicely with this idea of active environments and active systems, which is a WA priority. And in order to do this, we launched our Global Healthy and Sustainable City Indicators collaboration. And I'd really like to pay tribute and thank the executive of that study. We've been meeting every month ever since 2018. It's been a long relationship. And through our efforts, we managed to recruit over 80 collaborators in 25 cities, 19 countries, and 6 continents, because we wanted to do a proof of concept. Was it possible to measure indicators of the built environment in all these cities across the globe? And could we achieve that working together? Now, what was our goal here? We hear all our cities across the globe, and you can see that it's a mix of countries. So we've got not just high income countries, but we managed to get some low and middle income countries, and we'd really like to see that extended in our launch of the 1,000 City Challenge. Now, what was our goal? Well, our goal was to facilitate the development of a global system of city planning policy and spatial indicators. It was really important to do policy. Do we have the policies in place to deliver healthy and sustainable cities? And spatial indicators, which tells us about the lived experience of people on the ground. Now, why indicators? Well, indicators are specific, observable, measurable characteristics that we can use to show change or progress towards achieving a specific outcome. And in our case, what our idea was that we wanted to create healthy and sustainable cities. And so we needed to have some sort of measure, an indicator of whether or not we were achieving that. Now, the reason why we did this, because we took the view that what gets measured gets done. It's hard to argue with evidence when you can see it on the ground. And the reason why we need data like this is no data, no problem, no action, as Sharon Friel has said in this publication. So data is very important because it tells us whether we've got a problem. It allows us to advocate for change, and setting up global surveillance systems, of this case of indicators, is really public health 101, very important to actually help to get this action on the ground. Now, Jim mentioned that we did a Lancet series in 2016, so we've just published the more recent one, but that was really based on the work we did in 2016. And in that 2016 series, we came up with a conceptual framework about the way cities affect people's health. Now, what we argued is if we're interested in injury and disease outcomes downstream, we need to think about the upstream determinants of that. Now, we identified 8 urban system policies, and these all work together to create 8 transport and urban planning interventions that encourage active transportation and decreased driving. We call these the 8 Ds. 3 of them are regional Ds: destination accessibility, which is around the public transport system, the distribution of employment, so that reduces commuting time, demand management, do we have policies that reduce the demand for driving, but also the local urban design, the design of the street networks, the density of the housing, the diversity of the shops and services nearby, and the diversity of housing that's available, distance to transit, and the desirability. Is it safe? Is it pleasant? All these sorts of measures. So these were the 8 Ds. Now, what we said in the series 1 is that we needed to have indicators measuring these policies and interventions on the ground. So we recommended it in series 1, and we set about measuring it in series 2. We set about a set of policy indicators, which Melanie is going to explain to you very shortly. And we said we needed to be measuring, do we have the policies in place to deliver healthy and sustainable cities? And then we had to have spatial indicators, because that would tell us about the lived experience. It would allow us to identify inequities across the city. And so we wanted to create spatial indicators of interventions. And Carl Higgs is going to be presenting that to you. Now I'm going to hand over now to Deborah Salvo. She's going to be telling you about the 1,000 City Challenge and the opportunity for you to join us in our next adventure about the 1,000 City Challenge. So over to you, Deb.
Thank you very much, Billy, and thank you very much, everyone, for joining today. So, as Billy just explained, one important part of our work was developing the science, validating some indicators about what makes cities, both their policies and what's happening on the ground, be promotive of health and sustainability. But another very important part of our work is that we didn't just want to have a scientific exercise that was published in the Lancet Global Health. We wanted next to make this information available to everyone, and especially to those that have more power to do something to change policies and to change cities towards health and sustainability. So we established the Global Observatory of Healthy and Sustainable Cities, because what gets measured gets done. This observatory is hosted in a website that you see on screen, and it includes currently data on the 25 cities that were part of this proof of concept exercise. So through these 25 cities, we demonstrated that global surveillance on city level indicators can be done. We generated, in addition to hosting within the observatory, within the website, links to the scientific publications where you can find all the methodological details of what we did. We also developed scorecards, which are infographic type one-pagers, as well as more extended reports in a more digestible manner that can be easily read by government officials, by non-governmental organizations, or by any advocacy group or citizen that is interested in advocating for healthier and more sustainable cities. The observatory has currently been accessed by over 500 people and has had several downloads of our data, and we have been engaged by several people from across the world interested in using our observatory and learning more about our observatory from across multiple sectors. So beyond the academic sector. So as part of this observatory, we're launching the 1,000 Cities Challenge. Right now, while we do have 25 cities across all inhabited continents of the world, we realize that a lot of cities don't currently measure how they're doing in terms of their health and sustainability policies and spatial indicators. We want to upscale the observatory to include at least 1,000 cities globally. We are inviting city governments and organizations that work with geospatial data scientists, policy researchers, and the whole open data community to use our open source methods and tools to calculate indicators for their city. Importantly, these open source methods and tools are currently in the website, so you can easily access them. And as we say, they are free to access and open source. If you join the challenge, we will be providing training and support to help you understand how you can use these open source methods to calculate indicators for your own cities. And as part of this work, you'll also be able to generate equivalent reports and scorecards for your city to be hosted within the observatory. In terms of who we are, our project executive is currently led by 14 global leading healthy cities and geospatial science scholars from across the world. I have the pleasure of co-directing both the Global Observatory and the 1,000 Cities Challenge project with Dr. Melanie Lowe. Our membership manager is Eugene Resendis, so please get in touch with her if you have any questions about how to join the observatory. And we have teams that are specifically focused in helping people understand how to use our indicators and our tools, both from the spatial side and the policy side. So Drs. Jeff Boeing and Carl Higgs are leading the spatial team, and Dr. Melanie Lowe and Dr. Deepti Adlaka are leading our policy team. In terms of what we've done and where we're going, we are happy to report that we have now developed a comprehensive document. It's a PDF file that is hosted within our website and you can download that explains our pathway to participation guidelines. What do you need to do to become a part of the observatory? We have also worked with early adopters beyond the 25 initial cities that were included in the Lancet Global Health series publications and studies, so above and beyond those, to test some of our processes and tools for larger scale up. As you know, as you're sitting here today, we are hosting informational webinars pretty much to show this to the world and to welcome anyone that's interested in having their city hosted within the observatory and joining us. Next, we will be hosting training sessions specifically focused either on the policy indicators or the spatial indicators, so you can get a better sense of how it is that you use our tools and how you can replicate our process to calculate indicators for your own cities. And we will also develop online tutorial videos, both for the spatial and policy indicator data collection calculation processes that we will be hosted on our website that you will be able to access at any point in time if you are a member of our 1000 Cities Challenge. Our next phase, which really is around the corner, will begin about mid-May 2023. So like I said, around the corner, and it's really focused on upscaling city recruitment and taking this to a larger scale. So we're seeking to identify collaborators and partners in additional low and middle income countries and opportunities for capacity building. Obviously, we're not just looking for cities in low and middle income countries, but we are highlighting this as a specific activity that we will be doing outreach for, because we are very interested in being equitable and in really representing what's going on across the world and not just in a few countries that are in high income settings. We want to establish regional and country coordinators and mentors so that once we have several cities across countries or regions, they can serve as support in terms of lessons learned of what works best to collect data and calculate these indicators in the most efficient manner. Also on how to use the data, the indicators, and the advocacy tools, so the scorecard and the reports to generate change within your cities. And of course, one other thing that we're interested in is in developing and adding new indicators to the observatory. We are aware that the current set of indicators, while good, is insufficient, and there are several elements, for instance, air quality, that are currently not included in the observatory. So we want to take the time to do that too. So if you're interested in participating, what are the basic steps? Well, first of all, please sign up for the 1000 Cities Challenge. You can do this either through our website in the 1000 Cities Challenge tab. There's a button there that says sign up to participate in the 1000 Cities Challenge. You can also just scan this QR code on screen and it'll take you to a form where you will sign up. Once you sign up, you will be on our database and you will receive communications from us on next steps as they evolve. Second step is for you to assemble a team for your city. And the next slide will cover more of what that team should be composed of. Next, you and your team will receive training on data gathering and generating processes, data processing, and report generation. With this information, you will be applying our open access tools for calculating indicators for your city. And you will also be using these tools to generate scorecards and reports like the ones that we have for the 25 cities on the website right now. With all this done, you will submit your data, your scorecard, and your report for inclusion in the Global Observatory. And prior to that, we will have a few steps for validation to make sure that everything checks out and that the data look good, the reports look good, and everything's good to go to be included on the Global Observatory website. A final and important step for us, and the reason why we really are interested in building partnerships versus only going in and doing helicopter research and calculating indicators ourselves for cities where we've never stepped a foot in, is that we really want this to be used as a tool for local policymakers and relevant actors to start using it as a goal-setting approach and to track progress in turning their city policies and their on-the-ground lived environments into things that are more healthy and more sustainable moving forward. So if you're thinking of assembling a city team or even country level or regional to cover more than one city, what should you be looking for? We are looking for people from your city that have expertise in government policy, people that are willing to learn how to use our spatial analysis tools with training and support. And we are emphasizing the willing to learn component because we want to say that not knowing how to code, not knowing how to do advanced data analysis should not be seen as a barrier for participation. We will be providing training and support. And really all that's needed is the interest in this and certainly some inclination towards computers and these types of things. And and programming, but you don't need to come in knowing how to code to do this. We are importantly also looking for people in the advocacy sector, people that can really connect us and help us use the data generated by these indicators, the reports and the scorecards, to turn it into action at the local level. Ideally, obviously, we want teams to generate both policy and spatial indicators, but we do want to emphasize that it is possible to initially join the challenge and only calculate one of the two types of indicators if you think that that's where the capacity is currently with your team. So in terms of why you should join, well, first, if you join our observatory, you'd be enrolling your city in our global observatory, and you can be confident that you are in a global observatory that uses evidence-informed indicators and thresholds for diagnosing urban design and policies for health and sustainability. There are a lot of different initiatives out there, and some are really good. So we're not saying anything bad about them. But what we bring to the table is that the indicators that we are generating have been tested and have been validated for being associated with health-related benefits. And we think that that evidence-informed piece is very important. By joining us, you'd become an official member of the Global Healthy and Sustainable City Indicators collaboration of a team of 80 plus collaborators across the globe working towards building evidence for healthier and more sustainable cities. You would also help lead scientific and/or practice-oriented dissemination and advocacy activities, including the process of identifying and generating and validating new indicators for the observatory. You would be actively contributing to establish local capacity for advanced policy and spatial analysis in support of your city's health and sustainability. And finally, of course, you would be included as authors in future publications. And I do want to share that we've been in talks with the Lancet Global Health to have a follow-up series to report progress in what we've been doing in a few years. Finally, I do want to highlight what our guiding principles are. Our principles are to use global data for local impact, to focus on capacity building and equitable international collaborations for long-term sustainability, to use open data and open science, and to use interdisciplinary team science. So with this, we invite you to join our observatory, and it is my pleasure to introduce Dr. Melanie Lowe that will tell you a little bit more about the process for policy indicators.
Thanks very much, Deb. And as I go into this presentation focused on the policy indicators, I do want to acknowledge my colleague, Dick Adlaka, who co-leads the policy indicator team with me. As Billy has mentioned, the policies are really the upstream determinants of health and sustainability. And the indicators for the 1,000 Cities Challenge, the policy indicators, they assess and compare both the presence and the quality of policies that determine health and sustainability. So these indicators enable a comprehensive assessment of urban and transport policies for your city. The policy indicators can be used to benchmark as well as compare cities internationally, and importantly, to monitor progress towards healthy and sustainable cities. By identifying specific policy strengths as well as gaps and limitations, the indicators can usefully inform new policy development as well as potentially reforms or changes to existing policies. So the policy indicators that we've included in the 1,000 Cities Challenge are quite a comprehensive group of measures that are based on evidence. And as Billy outlined in her presentation, they originate from last year's Lancet Global Health series on urban design, transport and health. And they cover measures related to a whole range of aspects. So integrated land use and transport planning, air pollution controls in land use and transport systems, destination accessibility by public transport, distribution of employment, and demand management, particularly car parking restrictions. A whole range of aspects of urban design, housing density, distance to public transport, transport infrastructure investment by mode, disaster mitigation, desirability of the neighbourhood for walkability, the diversity of land uses, and destination proximity. So you can see a lot of those Ds there, as well as some others. So quite a broad range of measures. And the first 9 of those domains were measured in the 2022 Lancet Global Health Series. And the last 4 are currently being added to the 1,000 Cities Challenge to reflect the latest evidence and also the recommendations that were developed in the series and our subsequent discussions with experts. So for the policy indicators, someone will need to collect policy data for your city. So it could be yourself, or you might be thinking about someone who you could work with who has the relevant knowledge or skills. So it would be useful if the person that was working on the policy indicators for your city, if they had a good general knowledge of government, urban and transport policy in your local context, or if a more basic knowledge, certainly a willingness to learn with the help of training and support from our team. So previous experience in policy analysis is a good thing, but certainly not essential. And the team members, it could be one person or it could be more than one person, and they may come from a university setting, so an academic or a master's or PhD student in urban or transport planning. They could be city or regional government staff or an official, or even someone from a local healthy cities or sustainability advocacy organisation who works in that local context. So for the challenge, we have developed an easy to use policy checklist, which guides teams through the process of collecting policy data. So firstly, it helps city teams to identify the relevant policy documents. And once that's done, to find and then extract the relevant policy details and content, to work with the 1,000 Cities team to check the validity of that policy information. And when submitted, the policy assessment can then generate the city report and scorecard for your city. So the policy checklist is designed to collect policy data for the levels of government that are responsible for the whole metropolitan area, or that affect the majority of the metropolitan population. So it could be more than one level of government in your context, but just to emphasise that we're trying to include that metropolitan level and not just local jurisdictions that cover a smaller sub-area within the metropolitan area. So if you are from a municipal government or a local government that is a sub-area within a larger city, certainly we encourage you to use our open source tools and even attend our training, and reports can be generated for your city, but those won't be included at this point on the Global Observatory. So the data collection will require identifying, assessing the content of multiple documents, policies, guidelines, strategies, regulations and legislation. And we will be providing the training and support, which I'll talk about more in a moment. So here are some examples of the types of measures included in the policy checklist, everything from health impact assessment requirements, transport policies to limit air pollution, public open space, street connectivity and public transport access requirements. And for each measure, the policy checklist asks a series of questions that are based on evidence of best practice policy. So, is there a relevant policy for the particular measure? And if so, what is the relevant policy wording or content? Is there a measurable target attached to that policy which helps to guide implementation and accountability? And is the target an evidence-informed threshold? So by submitting the policy checklist, that will generate a report and a scorecard for your city, showing either just the policy indicators on their own or alongside the spatial indicators, depending on what indicators have been generated for your city. So the current report template is shown here. We are amending this slightly for the 1,000 Cities Challenge, but it shows checklists of policy presence and policy quality. And then there's the infographic scorecard, which Deb has already highlighted, a single page summary of findings, including for the policy indicators. And just to zoom in there, the policy checklist clearly demonstrates in what areas a policy exists, whether they support health and sustainability, and whether they have that measurable target. So how do you get started with the policy indicators? Well, as I've said, the first step really is identifying who will collect the policy data for your city, and that may require assembling a team. The policy checklist will be available for you to download and fill in, so freely available. We have online policy indicator training sessions coming up, and we really encourage anyone interested to attend those and learn more about the steps involved. We'll step people through in more detail, and that's anticipated for mid-May. So more details will be available soon, and make sure you have signed up via the website so you can receive those updates from us. So it's now my pleasure to introduce Carl Higgs, my colleague at RMIT University, who leads the spatial indicator team for the 1000 Cities Challenge, as well as the software development.
Thank you, Melanie. Thanks. So for the 1000 Cities Challenge, we've developed a flexible and streamlined open source tool to support creating spatial indicators of the social determinants of health for examining within and between city inequities in diverse settings, and for tracking progress towards achieving policy targets and sustainable development goals. Our collaborative workflow begins and ends with local knowledge, from input data collection to output indicator interpretation. And this is designed to support evidence-based planning interventions, monitoring of policy effects, and harnessing lessons learned from peer cities. Using our software, you'll be able to calculate a suite of indicators for healthy and sustainable cities using open or custom data. These indicators measure key determinants of healthy and sustainable built environments. So our software allows you to calculate indicators for sample points across the city and aggregate these to generate high resolution maps to identify inequities relating to aspects such as accessibility and walkability across your city, as well as producing overall city summaries. And in addition to producing data sets for neighborhoods and overall cities that can be published and used as open data, our software supports users to generate additional resources to communicate findings and enhance impact, including maps, figures, reports, and infographic scorecards that can be used for a range of purposes. For example, supporting local town hall events to discuss what these results mean for your city and how they can help planning for more health supportive and sustainable neighborhoods. So our approach is underscored by a commitment to open science that promotes open access to scientific publications and research data, encourages community collaboration and engagement with diverse ways of understanding the world. And motivated by these goals, by these global open science ideals, you'll be able to generate data summaries and reports in your local language using our software. Through iterative feedback cycles, the translations can be refined for different target audiences until the generated figures and reports are approved by you for publication. So you don't need to be a computer science expert to get started. When you run the software yourself, you have control over configuring the inputs and the outputs and all the related narratives and reports. This provides flexibility for information to be tailored and shaped for different audiences and purposes in a systematic way. Once the software is downloaded, installed, and run, it guides the user through this three-step process of configuration, analysis, and reporting. Validation with local partners to ensure that the indicators and the way that they're measured and reported is fit for use in diverse settings is a real priority, and we'll be continuing to develop additional materials to guide users through this process. So finally, to get started, you can download our software at the URL here on the screen, and you'll also find at that URL comprehensive documentation and tutorials to get you up and running. The software works on a standard personal computer, a laptop or a desktop, and it expects the user to have computer familiarity, but no advanced analytical skills are required. If you don't need to do any programming, it's just configuration and keeping a track of data. But we will guide you through this. So if you'd like more of a hands-on approach to getting started, well, we welcome you to attend one of our virtual training sessions, and we'll be having these in late April. To be notified of upcoming training sessions, please subscribe to our mailing list, and I'll now hand over to my colleague Eugen Resendez to talk more about how to become a member.
Thank you very much, Carl. Well, we're currently seeking for city governments and organizations that are working with geospatial data scientists, policy researchers, and anyone that is part of the open data community from around the world to join our challenge. We want people to be able to use our open access tools with your local urban spatial data and policy data so that you can generate indicators for your city or multiple cities. You can become involved in the development of new urban policy and spatial indicators for healthy and sustainable cities once you become a member, since we are going to be having activities with all members. There's 3 easy ways to become a member. The first option is you can visit our website and download the guidelines for participation, and also fill in the sign-up form, which I just shared on the chat. And all of this is at the 1,000 Cities Challenge tab. The second option is you can scan the QR code that I'm going to share in the next slide with your phone, and that will take you directly to the registration site. Finally, you can also contact us via email at info@healthysustainableCities.org, and you can just send an email to me. I'm answering that email, and for anything related to memberships, I am the point of contact, so I'll be happy to answer any questions you might have. Here's the QR code for you to scan and become a member, and also follow us on our social medias, since we are going to be sharing all of our events there. Thank you.
Great, and we can come back to that QR code in just a moment, but I did want to just to sum up, we really encourage anyone who is interested to join the challenge, spread the word amongst your networks. By becoming a member of the challenge, your city can join the Global Observatory, and you yourself or your team can become part of our global collaboration with those ongoing opportunities for research collaboration, engagement, advocacy, and new indicator development. So it's now time for us to have some questions from you, and encourage you now to, I can see we've already had some questions that are in the question and answer box, but please do keep adding your questions there as they come. And also, if you would prefer, you can raise your hand, and Eugen will help me to monitor who has a hand up, and we can ask you to unmute and ask your question verbally. So we will try and get to everyone's questions, but you know, given limitations on time, we may not get to everyone, but we will you certainly can email us after the webinar and we can follow up. But also we will be capturing all of the questions that are posted today and including them as part of our frequently asked questions page on the website, which will be shared after the webinar. So I'm just aware that we have had a couple of questions sitting in the Q&A for a little while, and thanks very much to the other presenters who have been starting to engage with those. But I did think we could perhaps go back to the first question which we had, which is, what do you consider to be a city? You know, we have countrywide data is the question. Is that appropriate, or would it need to be reduced for contributions to cities? Perhaps if I could just add to what Carl has added to the question and answers there, we don't have any particular criteria about the size of a city. So it could be quite a small urban agglomeration or a megacity, but we are looking at what, for your country context, would be regarded as urban, and that will differ greatly across the world in terms of the number of inhabitants. We're not really assessing countrywide data here, but if you do have good national data that can be disaggregated to a local city scale, that is certainly very appropriate. And we also have a question in the Q&A around equity. Are we going to measure equity? Maybe Deb, would you like to address that? So socio-economic spatial indicators that could help us reveal inequities, are we intending to add those?
Yes, thank you, Mel. We are currently working with a team of researchers from Brazil that are interested in developing and validating additional indicators that essentially help us diagnose the degree of inequities within a city, or some of the indicators that we already have. So for instance, for park availability in the city, it's not just about having an overall number in terms of how many neighborhoods or how many people have access to a park walking distance, but how different is that across different areas by socioeconomic status. And we will be working with them in this study, which we think will be very important and impactful, and hopefully, depending on the findings and whatnot, hopefully it will eventually become incorporated to our observatory and our scorecards and reports. Thank you.
Billy, you wanted to add something there?
Yeah, just to add, we are looking at spatial inequity, and that's why the spatial indicators are so important, because they do show the distribution of amenities in a city. And as Carl has said in the chat, one of the challenges that we've had is that when we looked at having, it's not that we've not been interested, it's just that it's quite difficult to get that data across the whole world. So there's no reason why cities could not add spatial indicators and look at the spatial distribution in terms of socioeconomic status at all. We've done that in Australia ourselves, actually. But the big challenge is when we're trying to do this on a global scale, not everyone has access to that.
I think someone else had their hand up, but it's disappeared. So continuing with the questions in the chat, do we have some kind of matchmaking process or any other way of combining efforts if multiple teams apply for the same city independently? Someone like to jump in?
I can
We
answer
certainly
that.
do.
Well, or Deborah, I think Deborah already put it.
No, you can go ahead. I think you're a
Yes,
membership manager.
so currently what we're doing is we're handling the matching of the teams manually. So whenever you register, someone from your team registers in our website, then I collect this data and I tried matching people based on their country or their city. Right now, we haven't been sending emails connecting you right now because we're waiting to have these webinars. But we're going to streamline this process so the matchmaking process is going to be easier. I just want to highlight that you don't need to have a full team or to register to the challenge. You can just register as an individual, and then we can match you with different teams that might be working in your city or country.
Thanks, Eugen. Reynald, your hand is up.
Hello, thanks a lot, Melanie and the team for this wonderful presentation. I have multiple questions, so I hope that I can, phrase them into one. First of all, with respect of the indicators, I'm kind of wondering, how do you integrate into the indicator, into the analysis, the elements that are related to the cities and the elements that are related to the buildings? I'm not an expert in that domain at all. I'm just kind of aggregating some data sets, like I don't remember his name exactly, but a gentleman from Harvard that is leading the healthy building effort, and brings into the table that the quality of a building per se is already an element of is already a determinant of health. So based on the quality of air and the ventilation and all these kind of things. And so where I'm heading is now in the indicators, how do you mix and match and disaggregate and aggregate, I would say, let's say the spatial aspects and the building aspects of a city, which is, I hope that it's clear enough around that. But how do you say that? As a matter of fact, I'm living in Le Havre, in Normandy at the moment. So making it as simple as a question is, well, how to guide the urbanization of Le Havre city as a whole, which is about, I mean, it's a complete territory, so that not only in terms of new buildings, in terms of transport, energy, adjustment, I mean, urbanization and so, and also ultimately, as I mentioned above, one of the issues we have in France is, and there's a lot of money and time put on that, which is in the aging element around it. There's a significant portion of a population that is aging not very well, i.e. Is aging with a lot of autonomy issues. And this is really a lot of effort is indeed towards that, as in how do we make the transformation, not only to support the non-autonomous people in the coming years, but how do we move from curative to preventive? So
yeah, very, very important questions there. Maybe I could make a start and then others could jump in. But I think the first part of your question was around the design of buildings and how that needs to be considered alongside the broader spatial planning environment of cities. Our work does focus on the built environment, but predominantly the what we define as or call city planning. So it focuses on the built form, but largely land use planning and transport planning systems. So we're not as focused in this indicator set on the design of buildings. But having said that, I agree with you that there's a very close relationship between the design of buildings and the design of the neighbourhood, and the interplay of those things is very interesting. And there may be scope for us to be thinking about aspects of building design and adding those indicators in the future. So as we said, this is a platform where we can be adding new measures as the evidence arises, and we've got people interested in adding those and that meet the criteria for being evidence-based, globally applicable, and can be measured consistently across the globe using the open data. Did anyone else want to jump in there?
If I may add, Mel, thank you for the question, Ronald. While we are focused on the built environment that happens sort of outside of closed doors, outside of buildings, one way in which this type of idea could eventually become a new indicator, if we see feasibility for it, is probably through the policy side first. There may be policies in cities about how you design buildings and if health is being taken into consideration. And yes, we agree there's a lot of evidence that shows how we should be building new buildings or improving existing ones. So again, this is, I believe, an opportunity if you're interested in joining our challenge, maybe for you to further share your ideas and help brainstorm ideas for new indicators that maybe can speak to some of these topics, including the topic of healthy aging in place, which we do think a lot of our current indicators are already getting at a lot of the features that are known to be associated to healthy aging in place, but there could certainly be more on both the policy and spatial side to that topic too. Thank you for the question.
Mel, we also have a very interesting question in our Q&A box. I'm going to read for everyone. Do you have any recommendations or resources to get cities that are likely to have low scores and might believe it will reflect badly on them, especially city governments, politics, and staff on board?
Yeah, that is a really important question. And the key focus of our observatory is, to enable cities to benchmark themselves and to compare to other cities where that's appropriate. But we don't really provide like a league table or a sense that, this is the top performing city and the worst performing city. So we hope that addresses some of the concerns around league tables for cities that make some cities feel very discouraged about where they currently are in comparison to cities that are further down the road of designing healthy and sustainable built environments. But yet those international comparisons are really useful. And so it's a balance of highlighting where cities sit. But I think the key thing is to view the indicators as a starting point. They're a monitoring system that can be measured at multiple time points is the objective. As the years progress, it may be possible for cities to be measured every 5 years and to actually track and measure progress. So with some optimism that things can change for the better over that time period. Jim or Billy, did you want to add anything to that objective?
Just to say that, what we're trying to do here is empower cities. So we see data as a tool for empowerment. It's true that, you know, no data, no problem, no action. But on the other hand, if you don't have data, then it's really hard to know what you're aiming for. And as Carla said in the chat, the focus is on creating indicators that are across the city so that we can see where interventions are needed. But also what we do in the reports is really highlight what cities can do to improve their situation. You know, one of the reasons why they might not have a walkable environment is that the densities are too low, or they don't have X, Y, or Z. And we tell people where they could strengthen their policies. And that's really, it's an empowerment tool. I think this is about empowerment. We want cities to change, and we don't want to, and we will encourage that in our capacity building activities around research translation. This is not about having a go at cities. It's about how can data be used by cities to be able to empower them to make change and to collect data in a cost-efficient sort of way to do that.
One thing I'd like to add is that as part of the team, you need to think about not only collecting the data and creating the indicators, but also getting the right expertise in using the data for the change efforts. So my recommendation is to find advocacy organizations interested in health, climate, or both. Or active transportation. There's all kinds of advocacy groups in many cities, and many of them would have a built-in interest in this kind of work. And I think it's even realistic for advocacy groups to take the lead in this and make this a tool that they use in their efforts.
Yeah, really important there. I'm hoping we have time just to answer a comment that was put a little while ago, but getting at how long should you estimate it would take to actually to collect the data. And Carl, I might throw to you first for the spatial indicators to give an indication of the time commitment.
Thanks, Melanie. Yeah, so yeah, as I wrote in the text box, it really depends on the city, but if what you can do is you can retrieve OpenStreetMap data for your region. You can get a subset, and on our website we kind of talk you through this. And if you retrieve the software, there's a fully configured example that has data from OpenStreetMap for this particular city. It's Las Palmas, it's a Spanish city. It has the global human settlements layer population data for that city, and on the website, again, we talk you through how you can retrieve data for just the population tiles for your city, or you can use your own official population data. That's an option if that's better for your city. You can have an urban boundary. You can optionally configure GTFS data. I feel like there's one data layer that I've forgotten, but if you know where to get this data, or you follow our guide, you could do it in a couple of hours and configure it. Realistically, there's a lot of detail there, and you do want to take care. So I think don't just do it in a couple of hours. You want to take care, because it's not just about getting the data. You really should be recording all the metadata around that data so it can be reproducible. And we kind of prompt you at that point in the configuration process, because the idea is you don't just generate data, you generate the documentation for the data, which will make it easier for you later on. So
yeah,
you could do it in an hour. You should probably take a little more, because you want to take care, and you want to then maybe interrogate that data, and so there's that kind of process. So maybe I think you want to allow a week or 2 weeks. Yeah.
And it's the same for the policy indicators in terms of the variability. And I think it really does speak to, who is collecting the policy data. If they're really intimately involved with the city planning, they may at their fingertips have all the policy documents required and almost off the top of their head know where to find the information. Or it might be a much more starting from scratch exercise. So again, it could be anything from quite a short amount of time. You might be able to do it in a day or two as an expert, but it could take weeks in not full time, but in chipping away at it to gather the right information, to perhaps check with local officials or policymakers to make sure that you actually are accessing all of the documents that you might need. So variable, and we'd certainly be happy to work with people one-on-one if they had more questions about the time commitment for your particular city, but also just to emphasise that this project is sort of beyond data collection. So we hope that when city teams sign up, there's that ongoing commitment to working as part of the collaboration to do that ongoing advocacy and engage as much as you wish with the monitoring of the city over time and engaging with us on future research collaboration. Unfortunately, we have run out of time, and thank you very much for everyone for staying on the call. We'll capture the questions and comments that we haven't got to in our frequently asked questions, and the recording will also be available on the website and shared with you after the webinar. I want to thank all of the presenters today, and again, the 1000 City Challenge broader team for setting this all up. And importantly to all of you for your participation and engagement and for attending. We really hope that this is the beginning of a journey together and that you'll join our collaboration and there'll be lots of opportunities for us to work together. So thank you very much.